8:07, and good morning to you two.
And HendrellRemus. HendrellRemus is on the line, and he is our new chair for the State Democratic Party. And I'm going to let Hendrell introduce himself to this area. He is brand new. He's been in office like 90 days. So, Hendrell, tell us something about yourself.
Good morning, Betty, and thank you all for having me this morning. I'm excited to get a chance to talk to the folks up in your area. So, my wife and I are originally from Memphis. We've lived in Nashville for the last 6 years. I have a background in business management and business operations. I worked in the private sector for a number of years before transitioning into the public sector, where I served as the Assistant Director of Emergency Management at Tennessee State University. I've been involved with politics since the Obama years. I got bitten by the Obama bug, ran for office myself. It didn't go as I planned, but it gave me an opportunity to really start getting engaged and involved. Worked with a number of candidates behind the scenes, doing everything from preparing robocalls and polling to filming commercials for them, both television and radio. I had an opportunity to serve as the national committee man for the Tennessee Young Democrats, to the Young Democrats of America organization. From there, I was appointed by the president of that organization to serve as an ex officio member of the State Democratic Party Executive Committee, and here I am now, chair of the state party. So I'm thrilled. The last decade's been a great journey, and I think we've got some good years ahead of us.
Well, thank you so much, and thank you so much for calling in. Is it as nasty in Nashville as it is in Winchester?
It's pretty nasty up here right now.
Oh, it sure is here. And listen, my co-host is Nancy Silvertooth, and Nancy will be asking you some questions too. Are you ready to take questions?
I am ready. Y'all put me in the hot seat this morning.
Okay. You're nearing the end of your first 90 days as chair. Just tell us, how has it been? And I for one, know that it's been really busy. Because you're so hard to get in touch with.
It has been really busy, but it's been exciting. It's been good work. We've had an opportunity to start to rebuild relationships with allied organizations, with the unions, establish new relationships with organizations that may not have been engaged or involved with the party. Then just doing the basic stuff of raising the money, preparing for the fundraisers, doing all the media pieces, and just trying to elevate the party as much as we can. A couple weeks ago, we announced some new members of our team that will be joining us in Nashville at the headquarters. We hired a new political director, Tamara Bates, who is originally from Tennessee. We were able to get her back to the state. She most recently worked on the elections down in Georgia, serving as a regional director to help flip the Senate seat for John Ossoff and Senator Warnock. So she's going to bring a plethora of new ideas and new organizing initiatives and tactics to the state, so I'm excited about that. We also brought Arsenio Williams on board as our new operations manager to help make sure that we have our business operations and business dealings as a party in line. And we have a new communications advisor who's going to help us reshape what the Tennessee Democratic Party's messaging is across the state, and that's Joshua Karp. Joshua served as the communications director for the Florida Democratic Party before becoming Andrew Gillum's deputy campaign manager, and he most recently served as the chief communication strategist for both Jamie Harrison and Senator Ossoff's senatorial campaigns. So I'm thrilled about what we have an opportunity to do. I've had a chance to talk to a number of county parties, a number of executive committee folks, and as we begin to lay out our planning for the future, begin the strategic planning process, and name our subcommittees to help lead the party in a new direction, I think we've got some excitement and some opportunities that we hadn't had before, and we're going to do some things to shake Tennessee up a bit.
Thank you. And I think Nancy has a question for you.
Hi, Hendrell. I'm Nancy.
Hey, Nancy.
Hi. So, glad you're calling in and being with us on this rainy morning. I'm Nancy Silvertooth here with Betty, and I want to ask you sort of touched on this already, but right now, what are your top priorities for the parties?
So right now, top priorities is to, when I ran for party chair, one of the things that I promised to do was make sure that we built the type of party infrastructure that will outlast the next chair, outlast the next executive committee, and be able to withstand election cycle after election cycle. So right now, top priority is making sure that we have the type of, we are starting to build the type of infrastructure that will do just that. That includes making sure that, we're raising funds and that we have enough cash on hand to be able to deliver on the programs and initiatives that we need to push. It means a top priority is making sure that we have functioning county parties so that they are the lifeline of the organization inside of communities across the state, and also making sure that we're, again, building those relationships that we need that will be crucial for us in the upcoming election year, because the one thing we know, and a good lesson from the state of Georgia, is that the state party can't do it alone. We have to make sure that we're leaning on our allies and building the type of collaborative, cohesive relationships that will help us to maximize our impact across the state and expand our reach into communities across the state. So those are top priorities for me right now.
Sounds good, Hendrell. Go for it. Betty,
okay. For people living in rural parts of our state who ask if you have a plan to make inroads there, what do you tell them? And if there is a plan, what does it consist of? Franklin County was one of the last counties in the state to go Republican, but it finally did. So we need some help in the rural areas.
Absolutely. We do have a plan for rural Tennessee, and I don't think that we could be successful as a party without putting focus and emphasis on rural Tennessee. I know that we've got a lot of work to do to win people in rural Tennessee back over, because they've been just so detached from the Democratic Party's messaging. Task number one is making sure that we begin to meet people where they are. We can't sit in Nashville or sit in D.C. and tell folks, hey, this is what you should do, this is how you should do it. We've got to make sure that we're on the ground listening to the concerns of those citizens in rural Tennessee. Because I have a simple philosophy. You can't lead people if you're not listening to them, and you can't represent them if you don't understand where they're coming from. And a big part of that is, number one, stopping to listen. So I'll be hitting the road across the state with my team to spend some time at the local diners, and once we get past this pandemic, at local sporting events, and talking to folks at the local bank, because I want to know where people are when it comes to the ideology of where they believe we could make some impact. And a big part of that, I think, is how we approach politics and what matters to people the most. We're going to be focused wholeheartedly on the economy, healthcare, and education, because I believe that those are issues that, no matter if you live in urban parts of the state, rural parts of the state, or suburban parts of the state, those are the core issues that are impacting that are impacting people's lives the most, and we're going to be focused on that, laser focused on it.
And the least talked about thing in the legislature, it seems.
Yes.
And that's what we need.
We know that about 90% of what goes on in the legislature never makes it back to the community. We only get the most reckless 10% that makes it back.
Okay.
Hendrell, I've got the next one. We've seen some of the legislation that has been working its way through the legislature. Is any of it particularly alarming to you, and what can we do to stop it?
Yeah, absolutely. There's a number of pieces that are alarming to me. I wish I could stop it all, but the reality is, with Republicans having the supermajority, it becomes extremely hard for us to be able to really truly stop legislation. One of the pieces that stands out to me the most is this right to work bill, where where the state legislators are hell bent on changing the state's constitution to strip working folks of their rights to be able to say, hey, I want a decent wage. Hey, I want good benefits. Hey, I want strong protections. And if we allow them to strip workers of their rights, even if it's not folks in the labor union, this will impact people working in every industry across the state, where we know people are already, big businesses already running rampant. They're already, driving people off the cliff economically, and they try to do the bare minimum as it is when it comes to benefits and protections for workers. So we've got to do everything we can as a party and as a people in this state to make sure that we're protecting workers' rights and standing up for fair wages and good benefits. So as we begin to see this legislation move through the legislature and on to possibly the ballot, we've got to make sure that we're mobilized and engaged and ready to defeat it, so that we're standing up for working folks in the state.
Okay, this is an interest of everybody's. Have you identified a candidate to recruit to run for governor?
That's the $1 million question. Everybody wants to know. Obviously, I've talked to a number of people who are thinking about running for governor. I haven't actively began recruiting anyone. I believe that democracy should play itself out. I believe that we will have some strong candidates who essentially emerge in the Democratic primary. And one of the things that I'm focused on is making sure that once that primary is over, the Democratic Party coalesces around our candidate, and we focus our resources on defeating Bill Lee, because I think we've got a shot to do it. Here's a governor who has, truly left tens of thousands of Tennesseans behind. Here's a governor who, most recently said the state doesn't need any funding from the American Rescue Plan, that Tennesseans don't need stimulus checks, or small businesses don't need economic relief through the PPP loans. Here's a governor who has been sitting on $2 billion in a rainy day fund, who hadn't realized that, literally it's raining, Mr. Governor. People are being crushed economically, and he's sitting on money that could help Tennessee families. So I think whoever becomes our gubernatorial nominee, I think we will have a task ahead of us to unseat this reckless governor that we have right now. Someone who truly has shown that he cares more about big business than he cares about ordinary people who are struggling just to make ends meet in the state.
Well, I'm hearing that he will have Republican opposition in his primary.
Well, let me encourage a competitive primary on their side. It's
well,
great for democracy.
I'm hearing that he very possibly will have, because of his because of some of his governing habits. So
yeah,
maybe he will.
One of the things we've seen here recently from him, and maybe it's because he fears that he's going to run in a primary. Here he has really gone to the fringes. I think he's even out of touch with Republicans on a lot of the issues.
I do too.
And a lot of the ways of doing things. He's becoming more reckless by the days. The closer it gets to his reelection, the more reckless he's becoming as a governor, and the more it's beginning to show that he truly doesn't care about ordinary folks. He's serving himself, and a lot of what he said when he originally ran for office is proven that he's a phony, in my opinion.
I am told that he was in conference with the NRA when the shooting was going on in Colorado. And, of course, he came out right after that and said that was not what caused that we didn't need gun control, just right after that. So the NRA still has a big part in our governing. Okay.
Okay. Hendrell, if a statewide election were held right now, do you believe that Democrats would be competitive?
I believe we could be competitive. One of the shiny spots of 2022 is that, despite the increase in voter turnout and the former President Trump winning the state by one of the largest margins in the country, one of the things that we saw was that Democrats didn't lose a single House seat, and we actually picked up a Senate seat with me at the helm of the organization, and switching our messaging to education and healthcare and the economy. I think that we will have a strong chance at winning a statewide race. If one was held today, I think, especially at the height of a lot of the Democratic policies that we've seen come out of Washington here recently with the American Rescue Bill, that's extremely popular among Tennesseans and folks across the country. I believe that people really truly get a chance to see what it's like having Democratic leadership at the helm and how it benefits ordinary folks who are really struggling to get by.
Yeah, we hope so, Hendrell. Big Betty has the next one.
President Biden has passed the largest economic relief bill since the Great Depression. Do you think the bill will benefit Tennessee?
Oh, absolutely. Absolutely. Number one, let me keep it as simple as possible. The American Rescue Plan it helps get shots in arms and checks in banks for folks. And those are the two most important things to the country right now. Getting people vaccinated so that we can get rid of these masks and get back to normal. And then getting checks in people's pockets so that they can pay down some of this debt that they've gotten in during this pandemic, so that they can pay off some of the bills, so that they can buy a decent meal, and so that they can feel that, hey, here's an opportunity for me to start to get the wheels moving again. And all of that allows us to stimulate our economy. The American Rescue Plan will allow, for the first time in a state like Tennessee, where so many children are living in households that's drowned in poverty, will allow monthly checks will go out to impoverished families for the next 2 years to make sure that we can pull these families out of poverty, especially these young children. People talk a lot about getting children back to school. I'm glad my son's back to school, and we need to make sure that we have the resources to ensure that until they get a vaccine for children, that our schools are prepared to reopen and have children back. And one of the things about this plan is that it allocates billions of dollars to the tune of about $80 billion to make sure that schools are equipped to reopen and look out for children and teachers when they do. But the bill also does something for folks in the realm of health care. We know the governor refuses to expand health care to Tennesseans. We have nearly 400,000 Tennesseans who could benefit from Medicaid expansion across the state. This bill offers an additional $900 million to Tennessee to expand health care to people in this state. Wouldn't cost the state a single dime. But, we hope that the governor will finally get on board and make sure that we can keep people in Tennessee healthy. So there's a whole host of things that will help people from this bill. And I believe that once people, get a chance to see what Democratic policies can do to help better their lives, it puts us in a strong position as a party. And it helps us to strengthen who we are as a state and a nation. So, I'm glad that the bill passed, and people are already feeling it. I know that over 100 million of relief checks has already gone out to people, tens of thousands of folks right here in Tennessee.
I'm so glad that Nancy has the next question, because I need to tell you that she has taken all the training on Medicaid expansion, and she is real well versed on that. And back to the stimulus checks, I have not yet seen in writing how much anybody's going to get. I want to see it in writing. I have heard on the news, but then it's just in passing, and I'd like to see and like to hear that. But Nancy has the next question about Medicaid.
Right. With regard to the expansion of Medicaid, Hendrell, across Tennessee, rural hospitals have closed, of course, which is tragic in addition to the thousands of our folks who are going uninsured because Tennessee refuses to expand Medicaid. Do you think, and you've already partially covered this, do you think that Tennessee can benefit from expanding Medicaid, and especially with regard to our hospitals that have had to close?
Absolutely. When we're able to make sure that people have access to quality, affordable health care, it means that hospitals within communities, especially out in rural areas, that people can get treatment inside of their own communities. They don't have to drive 45 minutes or an hour to the nearest city in order to get quality treatment. It means that we could have more clinics that could pop up to help treat patients, and hospitals and providers will feel that, hey, we can really survive in these areas because now we have the citizens in this area have the health care and health insurance options to be able to pay for the services that they need. So Medicaid expansion and making sure that people have access to quality, affordable health care should be a top priority in this state. And I say this all the time. This is a no-brainer. It doesn't matter if you're in big business or if you're a small business owner. It doesn't matter if you don't work at all. If people across this state are not healthy, then the future of this state is in jeopardy. And again, I grew up in a Christian household. You should care about the people in this state. And if you truly, believe like so many of us who share a Christian faith believe that, we should look out for people, then healthcare should be a top priority. Making sure that people can live should be a top priority, and live without, the thought of, hey, I'm going to get sick and I'm either going to die because I can't afford the prescriptions, or I'm going to go bankrupt because I'm going to have to use every single dime that I get in order to afford a prescription, or I'm going to have to choose between whether or not I'm going to get a decent meal tonight or pay for the medicines that I need. That's ridiculous. We shouldn't have anybody who is concerned about, hey, I can't afford to get sick. Just think about that. I can't afford to get sick, or this might be the end for me. That shouldn't be the reality here in Tennessee, especially when every other states all across the country have expanded Medicaid, joined the Medicaid expansion program, and the federal government is saying, hey, Tennessee, here's billions of dollars. You don't have to spend a dime. Here's billions of dollars to look out for your people. But we have a governor and a legislature who's saying, no, we don't want it. Let these people fend for themselves. It's pretty much what they're saying.
I know. If I could just understand.
To me, that is devastatingly heartbreaking.
It is, and I wholeheartedly agree with your opinion that our people in the legislature and in offices that can do something don't seem to care that much about people not having health care.
And let our money go to other states, our money that's already there. I just wish I could understand what their thinking is. It just really grieves me that happens. How much money are we losing every year? You had said that one time before. Can you say that off the top of your head?
I don't know the exact figure, but it's in the billions, and we have an opportunity to get an additional like $900 million more in this rescue plan. And again, here's a governor saying, no, we don't want it. We don't want it. But the first opportunity he has to give money to big businesses, he's going to do it.
Yeah.
But when it comes to paying and giving money to ordinary people for their health care, for instances like their health care, or to make sure that they can buy food, He refuses to do it. The guy's sitting on $2 billion in the reserves, and he's running around the state, clapping and shouting and screaming and with excitement that he's holding $2 billion away from people in money that we've already got. And then there's an additional $4 or $5 billion from the federal government for health care that he's saying that we don't need. We do need it. People are unhealthy and people are going broke in this state.
And our education system is what, fifth from the bottom?
Yep.
Way down there. I'm a retired teacher, so that grieves me every day too. Okay, I have the next question. What is the Tennessee Democratic Party planning to do to make sure that more people can vote? I just can't believe that they're trying to keep people from voting.
Yeah, I think there's been some crazy bills that showed up this legislative session. We had a representative put a bill out there that would do away with electronic voting.
Yeah.
Go back to paper ballots. The only thing she was missing was saying that we need to chisel our name in stone. I don't think Democrats or Republicans are looking to go backwards when it comes to making voting easier. One of the things that, and people keep talking about this absentee voter and mail-in voting, one of the things that, we learned is that mail-in voting and absentee voting and extended early voting in this last election didn't just benefit Democrats. There's a whole lot of Republicans who have benefited as well. You saw increases in Democratic voter turnout and Republican voter turnout. We had some of the highest voter turnout in the state, which goes to show that when you give people access to make it easier to vote, folks will get engaged and they will carry out their constitutional right. But for some reason, and there's a group of Republicans who I think they fear even losing their seats on the Republican side to other Republicans when you give more Republicans the right to vote. They're afraid that when ordinary people are able to go out and say, hey, I'm sick and tired of the way these politicians are dividing the state, are dividing the country, are leaving ordinary people behind, and they fear that so much that they're willing to protect their own themselves in their Republican primaries and then keep the competition from the other side from emerging as well. So I think it's a self-serving interest. They're not looking out for the interests of ordinary people, and that's a trend that we continue to see across Tennessee, where politicians are looking out for themselves, and they're not really, excuse my language, giving a damn about ordinary people.
They're there to get reelected, not to serve the people.
Absolutely.
That is sad. That is sad when I hear a representative say, I represent my people, when 60, I don't know what percent of the people want to expand Medicaid, and that person votes against it every chance they get, and they say, I represent my people. I don't think so. Nancy, do you have anything?
Well, just that when we really think why our elected people do what they do, they supposedly are responding to or doing what they think their voters want. And for instance, with regard to expanding Medicaid, everyone having insurance. And by the way, as you indicated, the latest Vanderbilt polls showed that 60-something% of the people do favor,
I believe 67 or 68%. Right. But that makes no difference.
And I think I saw information with regard to a nationwide poll that what people are interested in out there, number one, the list of things that people really cared about. Number one was their freedom, their rights. Number two, health care. Health care has shot to the top. I think several years ago it didn't get the attention that it's getting now. But health care, being able to get health care just affects, it has an effect that a mother in the family not able, a family member, a parent not able to get health care, that's going to affect that whole household, and it's just health care is just sort of on top of my list there.
And I'm anxious to see drugs, the prescription drug costs go down also. I'm telling you, I've got one prescription that costs $389 every time I have it filled. That's a lot of money for one prescription. And I understand people who don't have insurance. I had a fall, and that fall charged the insurance company $2,400. So really, you can't afford to fall, and you can't afford to be sick. I understand the term that says I can't afford to get sick.
Yeah, and it makes it even more difficult. I mean, you have areas like in rural parts of the state where hospitals have closed. You know, most people across the state, they don't have a primary care physician. When people get sick and they find out, for the first time they're finding out that they have cancer, or they have diabetes, or they have a heart issue, they're finding out at the emergency room. But people in rural parts of the state, they don't even have that luxury anymore because they're seeing hospitals in their areas closed. So they've got no clinics. They have no health care insurance. And then the emergency rooms that they depend on as a lifeline are now disappearing as well. I think there's some soul searching that our elected officials have got to do, and they've got to decide, are they going to look out for themselves, or are they going to look out for ordinary people who people aren't looking for a handout. People want to make sure that when they can survive, they are given the opportunity to survive and thrive and live a long, healthy life. And I think that's what people are looking for.
I always say the thing worse than working is not being able to. It is really devastating not to be able to work, to me. And in Tennessee, I think we have lost more hospitals per capita than any other state. Is that not true?
I think don't quote me on it, but I think those numbers are pretty high compared to the national national numbers and what other states are seeing happen. But something that's interesting is that we always look at it, a hospital closing from just a healthcare perspective. A lot of times when you shutter these hospitals, you shutter the economies in a lot of these rural areas, because these hospitals employ more than just doctors and nurses. There's folks who are working the dining facilities. There's folks who are cleaning those hospitals. There's folks who are working at the gas stations that fill up the cars of the doctors and nurses and staff during shift changes. I mean, there's a whole host of people who are put out of work when a rural hospital closes. Right. And we've got to get to a point where we're pointing out that when you shut the doors of a hospital or you shut the doors of a school, you are essentially shutting the doors of that community.
Well, ordinary people, so many what we call ordinary people dealing with the kitchen table issues need to be out voting for people in the legislature and other offices that would really help them, and we need to fire them up. And Hendrell, thank you so much. This has been very informative, and I've enjoyed
20 minutes.
We got. I may not take 20 minutes with insurance, but I wanted to mention a couple of things about some insurance dates that people know about. But we got until 9 o'clock, Hendrell, if you want to add anything.
I think we hit the nail on the head on a lot of these issues. I'm looking forward to coming out to your area and hosting some events and meeting some folks out there and just continuing to have that conversation with ordinary people, because again, you can't lead folks if you're not listening to them, and you can't represent them if you don't understand them. And I think for a long time there's been so many politicians who've been talking, but they really hadn't truly been talking to people or accurately talking for people. So, I mean, I'm excited about what the future holds, and I'm looking forward to the work we can do across the state.
Well, we had our first executive committee meeting in person the other night, last week. So we're starting to meet, and we certainly will invite you down when we have a big meeting. See, we didn't get to have our fundraiser last year. We have really been handicapped, like everybody else, for a year. So we will be in touch when that happens. Is there anything else you'd like to cover?
That is all that I have, and ladies, thank you for having me this morning.
We're just delighted that you called in, and thank you again, and we'll be in touch.
All right, thank you all.
Okay, thank you. We've been listening to Remus. I don't know whether it's Remus or Remus. He's our new state chair of our Tennessee Democratic Party, and he's very, very informed. I'm proud of him. I'm proud of what we heard. Proud of what we heard from Hendrell. I'll mention a couple of insurance dates that we need to bear in mind right quick. Just two things. March 31st. One thing is two different types of insurance. One has to do with Medicare, and the other, the Affordable Care Act. You've probably seen the TV ads and other ads from insurance companies wanting you to sign up for Medicare Advantage. This is an additional, from January to March 31st, there's an additional sign-up period, enrollment period for, it must be just Medicare Advantage, because that's what I see advertised. I have nothing against Medicare Advantage, but I want to sort of warn you, and most of us know we should do this. If you sign up for Medicare Advantage, make sure before March 31st that your medical providers will accept the plan that you sign up for. I had a friend last year that had a terrible experience. He saw an ad on TV, sounded good. He signed up for a Medicare Advantage plan in March, and then found out in April that his medical providers would not accept it. And after that March 31st enrollment period, it's more difficult to get it changed, to get it canceled. We finally got it done, but it was not easy. So if you are thinking about or have signed up for a Medicare Advantage plan during this period of time, make sure your providers will accept it, because after March 31st, you're going to have a hard time changing it. And, of course, that has to do with any insurance plan you sign up for. Make sure first that your providers will accept it, and you need to just call them up and ask them. Sometimes you can't depend on what you see in the computer. Okay,
I'm glad you covered that, because it is very tempting. I wondered if I should sign up for it, but then I remembered what you said. I had heard you say that before. And if you're a provider, that means you got to change doctors and everything if you get the wrong.
If you sign up, and this man had home health, which he desperately needed, and he just had a real problem there for a month until he could get it changed.
And then you might have to go out of town to a doctor. So you need to really be careful.
Be careful of these Medicare Advantage plans. And I want to give you a phone number that can help you with this. Let me see. I'm going to tell you while you're looking for pen and paper, because this is a number you need. I don't know if you've heard about SHIP or not. SHIP, SHIP. That stands for. It's a state agency, Tennessee agency, State Health Insurance Assistance, and I'm reading this now. This is a program funded by the Centers for Medicare and Medicaid Services and administered by the Tennessee Commission on Aging and Disability. SHIP was created in the early 90s to provide local assistance for beneficiaries with Medicare, and this agency is totally unbiased. They do not sell insurance or endorse any company. They will give you information. If you're on Medicare and you need information with regard to just what I'm talking about, whether or not you should change to a Medicare Advantage plan, and if so, which one. If you need help signing up for a Plan D, the prescription drug plan, here is the number for. And by the way, we're in the South Central Tennessee district. There's different districts. And their number is 931-379-2940, 2940. And there is a toll-free number. If you call the toll-free number, I think you'll get you won't get the local agency, but they'll direct you. The toll-free number is 866-836-6678.
Now, that's what I've been looking for, because I wanted to talk to somebody who could advise me that didn't want to sell me something.
And they will even help people with when you're trying to select the Plan D, the drug program. They even have you fill out a form that will help them to help you pick a plan. And they have been to, last year, a representative of this agency came to senior citizens and made a presentation, and I was very impressed. She was very knowledgeable. Of course, this year they didn't make an in-person appearance because of COVID. But call them on the phone. That number is 931-379-2940. If you have any question about Medicare Advantage, Plan D, and if you need to make any changes, be sure and do it before March, no later than March 31st, because that's when this enrollment period that we're in right now. In fact, I didn't know there was such an enrollment period until last year. My friend got in trouble, and I tried to help him, and we finally got it straightened out.
So imagine right now there's a little tone going out, and I'm about to interrupt this programming, okay?
Yeah.
We have this update from the school system that schools will be closing at 12 noon today due to the weather. Moore County has already announced, Bedford County has already announced they're closing this afternoon as well. There will be no ESP and no after-school programs today due to the worrying of flooding roads in our county. So the school system is being...
Okay.
I'm so glad they're doing that.
Yeah, I'll have to go get my little one that I took this morning at 8 then at 12 o'clock.
Yep, at 12 noon. So that's the latest from our school system. They just now put that word out.
Okay. Well, I'm glad they did.
Yeah, we need to know that.
I think it's going to really get bad.
Yeah, and I looked at radar. There's some pretty good storms rolling through over the next little bit here in the county. Okay. So I'm worried about you guys getting back home.
Yeah,
12:30. Oh, it says 12 here. 12. Somebody put the wrong thing here. 12:30 is the time that gets out.
12:30 instead of 12.
Yeah.
Okay. What about Tullahoma City?
They don't ever let out.
They don't?
Yeah, no, they don't ever let out.
You know, just like this summer school here this summer, see, Tullahoma acted like nothing was going on during COVID.
Right.
My daughter had kids in her room with high temperature and would test positive when they'd leave. She's been exposed no telling how many times.
So what do you think about them reducing the separation in the school, allowing them to go to 3 feet?
I don't think they should.
You think it should stay 6?
Especially when they don't wear masks.
You think it should stay 6 feet apart?
I'm afraid they should.
Right.
I know there's some concern with some teachers, you know.
All right, hey guys, let's get the official word, okay?
Yeah.
Let's do that.
It's an important message from Franklin County School District. To listen to the message, press 1.
Oops.
Stay on the line.
I got to hit 1.
Good morning. This is Delina McDonald with the Franklin County School System. Franklin County Schools will be closing today at 12:30 p.m. Thursday, March the 25th, due to the impending weather forecast. There will be no ESP or after-school activities. Again, Franklin County Schools will be closing today, Thursday, March the 25th at 12:30 p.m. Thank you and have a good day.
All right, the official word from the school system. There you go. All right, we're up to date.
Okay. I want to mention this right quick because this might be important to people, and I won't spend a lot of time.
You got 8 minutes.
Okay.
Because
insurance is boring to people if you're already covered, and you may turn me off.
I don't
but
care.
Don't do that.
I want to hear
Somebody else may be. This is something you need to do by March 31st. If this is a confusing thing, but
that's coming up.
I'm going to give you numbers
next week.
Yeah. I'm going to give you phone numbers for VR Williams and Hatchet Insurance because they will be a lot of help on this. But here's what this official notice says: if you need health insurance coverage now, if you're not currently enrolled in a marketplace plan and need coverage to start April 1st. Now, I think the sign-up period actually goes longer, but if you want insurance, if you don't have it now, and you want it by April 1st, get signed up by March 31st. Number one, what you got to do, start a marketplace application. If you're a computer guru and familiar with going on healthcare.gov, you can do this yourself. Go on healthcare.gov, sign up, select a plan. But then, number 2 says, come back after April 1st to see if you qualify for extra tax credits and update your plan selection with increased tax credits. Now, apparently what they're doing, they're not putting up the new, on the system, putting up the new premiums, for which will be, what they're doing is, the American Rescue Plan is increasing the premium tax credits that people will get, which the more tax credit you get, the less premium you pay. And they're saying that on the average, people will be paying $40 to $50 less starting April 1st. But this says, go ahead and sign up now if you're not already insured. Now, if you're already insured, you can just wait till April 1st and go on there and pick a plan and have the new premium and the new plan.
You didn't give any numbers on that.
I'm about to give you the number. You can call the marketplace. That's my school notice. Call the marketplace, and don't wait till the last minute. They get so busy at the last minute you have to wait forever. Call the marketplace at 1-800-315-2596. You can find that number anywhere. They'll have all the information. They can help you direct. You just got to be patient, get you a cup of coffee, and sit there and go through all this with them. Or see somebody at Hatchet Insurance, 967-7546, or VR Williams, 967-2268. And if you're totally confused, it isn't confusing, call me at 308-7150, and if I don't know it, I'll look it up. Sometimes you have to, you just have to do some digging. But
so this is for people that are not insured right now.
You're not insured right now, and you need insurance by April the 1st.
Why April 1st? Why is that an important date?
Because there's a deadline.
That's when the new prices go into effect. That's when the new lower premiums go into effect.
So if you don't get signed up by the 31st, then is it a longer wait period before you get back in it?
You got until May the 15th, actually. But if you wait till after April the 1st to sign up, you're not going to be insured till May the 1st.
Gotcha.
It's a whole... See, the insurance is only effective on the 1st of every month. And usually, if you sign up by the 15th of the month, but now they're telling us now. I mean, I got this offline on last night or this morning. I got it online. I pulled it offline. But anyway, if you need coverage now, get signed up for something before April 1st. Then, starting April 1st, the new prices will be there, and then. Even if you have to get somebody to help you, the insurance agencies, or just call the marketplace.
Are there any restrictions for these people? I mean, is there something that says you can't be insured?
The big restriction has to do with Medicaid expansion that we were just talking about, because the main thing that keeps people from getting the tax credits and getting cheap insurance is they have to have an estimated income for this year of at least 100% of the federal poverty level. And I got my little chart here. For one person, annually, it's for one person, it's $1,064 a month, or $12,760 per year. They got to be able to estimate, and it is just an estimate, and they got to be able to estimate they're going to have at least $12,760 income this year.
They have to at least make that much?
Well, they estimate. Right now, when you file an application, you estimate it. Now,
so if you fall under that, what do you do?
You're out of luck.
If you don't qualify for some current category of Medicare, you're out of luck and in the gap, and you're just out of luck.
Is there an age limit on any of this?
Yes. Well, from up to 18 or 19, many children, low-income children, are eligible for some type of TennCare or Cover Kids. They use an age for the Affordable Care Act of 18 to 64 because at 65 you get Medicare.
Mm-hmm.
And if you're eligible for Medicare, you're not eligible for the Affordable Care Act.
Right.
So if you're on Medicare, you call that number I gave you and you need help. But if you're up to 65, Affordable Care Act, and of course, if this table says if you're a family of two, you got to have an estimated income of $17,240, and of course it goes on up. And I wrote this down. The basic eligibility requirements are, in addition to the income, must live in the United States, must be a U.S. citizen or national, or be lawfully present. And you cannot be incarcerated, but incarcerated people can when they get out. They get a special enrollment period. And I wanted to... it's 9 o'clock or almost. I'll give you two quick numbers. Hendrell was talking about the difficulty of receiving treatment. Of course, we can all jump in the emergency room and sit and wait.
Yeah.
But we have a federally funded health clinic that does treat people, have primary care doctors present at Colmont, Tennessee. That's the closest one to us, and they charge according to a person's income. And if anybody needs that number, I'll just go ahead and give it to you, but if you don't get it, call me. It's 931-779-4002. And, of course, you got to call them and make an appointment. And I don't know how, with COVID still going on, I don't know how much they're doing. And, of course, Dr. Smith's group out at Volunteers in Medicine, call them for help, 968-2579. It's kind of limited to what they do, but they can tell you. 968-2579. But just be sure, and if you've got an income, the money that counts as income gets complicated. So call me if you have an iffy situation that's close to that federal poverty level. Or sometimes we can think of things that you can do.
I think Betty's ready to go.
She's ready to go.
Well, no, I just...
well, it's time to go. It's 1 minute after. But I wanted people to know about this
and I want to thank you for all that information, Nancy. That's valuable information.
Yeah, I wanted to get that out when I realized, it was just the last day or so that I realized what we do. I had been looking online for these reduced prices of insurance they've been talking about. Well, finally, I got the information on what we do. We got to go ahead and sign up before April 1st. Then on April 1st, when they put these new premiums up, we go back in. And thank y'all for listening. And call me at 308-7150, and I'll try to help you or look up stuff for you if I don't know it.
Common Sense Matters, sponsored by the Franklin County Democratic Party.
Thanks, ladies, for coming out. Some good stuff today.
Thank you.
You're listening to WCDT AM 1340, FM 106.9 in Winchester, Tennessee.